we'll let you know. So Thomas, you're the new man on campus, and you're
Right.
setting a culture there.
Yeah.
Let's talk about that, because I mean everyone knows about the shortages of people, and you guys are in a tough business. You hear a lot of things, you see a lot of things, and I always ask professionals, how do you guys see and do with it without it sticking to you? Because we
Yep.
just do something.
Yeah, you're right. And from to simplify that, I mean, you're talking about capacity, operational capacity, like how much can we really do to help the community, right? There's that kind of thing that I have to focus on. But then you also have to focus on the individual capacity of our staff and what they can handle on a day to day. Because again, if you're talking about not being fully staffed or 100% staffed or having those additional positions that you like to have in your operation, then that means that other people are picking up maybe an additional shift, staying a little bit later here and there. So first thing is you want to have a culture that prioritizes self-care. And self-care is an individualized approach, right? What works for me may not work for Eugene. What works for Eugene may not work for you, Mike. So I can speak from my own personal experience and how I kind of go about establishing this in our culture is I speak to our teams about the things that I do for self-care, right? I tell them that, hey, for me, it's about getting home at night and just kind of having a little bite to eat and hanging out with my daughter, man. That's it. I just want to sit with her, spend the time, soak up that moment. I think another important point is being mindful, right? Being present and knowing that, hey, when I'm at work, I'm at work. I'm present. I'm fully focused on what's in front of me. But when I leave, I'm not at work. So I want to turn that work mindset off and let my brain kind of relax. And I want to get home or want to get into my space. I want to have that simple routine that's going to help me kind of decompress. Because what I do, and my rule is, I don't take work home with me at night if I don't have to. So once I get in the door, I'm dad, right? I'm dad, I'm partner. I'm doing those roles that I need to do because being a father, being a partner, that is at the core of who I am. I am obviously a CEO and I do have a huge responsibility here, but I'm very confident in the team that we have and the senior leadership team that we have and the middle management folks that we have to push that culture forward and to encourage folks to participate in self-care, to encourage our senior leadership team to have these tough conversations about how do we continue to further our community here? How do we bring our staff closer together, right? Because like you said, Mike, this isn't easy stuff. This is very stressful at certain days. And as Eugene spoke to, the difference between a kid coming to our center and not coming to our center right now today, Mike, is basically safety. And I don't want to oversimplify the assessment process, but kids that come to our service, they're here because they're not safe in the community. And that speaks to both on our residential side and our acute side, right? So, in the behavioral health trend is that, hey, you never want to put a kid in inpatient or residential if they don't need it, right? So the first attempt is always to stabilize them in the community with different levels of care. Now you have IOP, you have PHP, but sometimes those services don't work, and young people need a higher level of service, which would mean maybe a short-term stay at our acute hospital or a long-term stay in our residential setting. But what's clearly important here is that, one, we understand our staff that are doing the job. We understand what their challenges are. And as leaders, we are solving problems, right? That's basically what I do is I help our senior leadership team, staff with ideas, suggestions, but kind of help them push things forward because, hey, we're all busy. We all got things coming at us from left and right. But it's important that you have that team concept. The culture is come to work. We want to provide a service of excellence. We want to have a balance where folks can actually put in their PTO time and get some downtime. We want to make sure that this is a place that folks can come and get a good start, either starting point in their career or new opportunities because they're passionate about serving this population. And I will also tell you this about our field, Michael, folks in behavioral health. We are a resilient bunch of folks. We do this because most of us have experienced something in our life that's beyond our control. And we made it through that, right? We build that resilience so that we can extend our hand to another person in our society that is also struggling. And maybe we can show them that it is possible to change that behavior, to build that resiliency, to have a better quality of life. Because at the end of the day, it's about quality of life. Life is not that long, it's short. We're here for a minute, but I want to be mindful and present where I am. And if I'm at work, I'm present with my team, discussing ways that we can improve the service that we provide. But if I'm at home, I'm dead, you know. But Eugene may call me at night, and you know, he may have a call for me or something like that. And that's okay, because that comes with the territory. I understand that. My family understands that. So communicating that expectation to my family is important, and also setting that boundary with our team members is also important as well.
So it's great. Thank you for taking the time. So Thomas and Eugene, I just want to be clear with this. So on New Year's Eve, it strikes 12 and it turns into New Year's Day. If I haven't done anything different, nothing's going to be different on New Year's Day. The same foolishness I was doing before, the same struggles I had, I'm still going to have those on New Year's Day because I haven't done anything.
That's right. Again, if we simplify it, you have to assess where you're at, right? Is it a dire situation, Mike? Right? Are you waking up in places you don't know where you are?
That's a problem, sir.
Dire situation. You need some help. You need some immediate help, right? Or is it one of those real small things that you're just, kind of like your Achilles heel, that one thing that you kind of haven't been able to get over the line? Maybe you don't need professional help for that. Maybe that's a friend or a family member you can confide in, but you have to share your challenges. We have to reduce this stigma, especially amongst men. We're 3 guys here. And
I'm good.
It has to be okay for us to say, hey, man, I'm not okay. I just need somebody to talk to. And from there, you can move forward, right? Maybe it's just that side conversation that kind of helps you reduce that stress, gave you some perspective. Or maybe if that's the catalyst for you reaching out and getting some professional help. I would encourage everything. Changing behavior is not easy, but it's so rewarding. And it is so rewarding, man. When you've had that challenge in front of you for so long and you built up that motivation, you leaned into a social support system. And the great thing about us is that we want to be the cheerleaders, right? We want folks to come and get our service, get what they need, build that toolkit, and get on out here back into the community and live a good quality of life. We want to cheer them on the way to do that. And again, I'm cheering not only our residents and our patients, but I want to cheer our staff too, because they do a remarkable job every day, 24/7, caring. Right now, we're up to 70 kids right now. That's 70 kids that are being met 24/7 here at Newport News alone. That is something for me to be very, very excited about. But again, we want to operate in excellence. We provide a great service and make sure the community knows how to get in contact with us. So we help. Thank you a lot, Michael, for the platform you've given us today, just to speak to what we do, to let the community know we're here to help.
You know what, man? I like that, operating excellence. I'm straight up stealing that. I'm taking that.
Mike, I stole that from my good friend of mine. The best friend of mine is he's a major in the Army, and he's working under a really high-ranking guy. I think he's like a general or something. And that's his thing. And I said, hey, explain that to me, man. What does that mean? Operating in excellence. That's a growth mindset.
That truly is. I like that. I like that.